Along the way, when she needed the higher level of care, it wasn't until she was broke. She had zero 401k left, and she was just relying on Social Security disability that the state of Georgia said, okay,
You can
she
get
qualified.
Medicaid.
Yeah, she qualified for Medicaid, and we'll take care of it moving forward. And what that brought to my mind was that makes no sense.
Welcome. Another episode of Healthcare with Healthcare Henry. Now, this one is important. This is important. We have someone here running for governor of Georgia. Many of you who do not know him, you're going to get to know him today, especially his policies and what he thinks about healthcare. Jason Esteves for governor. How are you?
I'm doing well. How are you?
I'm doing great. I want to definitely thank you for coming on. We're excited to kind of get right into this.
Let's get it.
One of the things for me, and I am a person who looks at everything from both sides, being both a caregiver and a healthcare business owner. I would consider you someone a part of that sandwich generation. So
Yes.
you took care of your kids and your mother, Linda.
Yeah.
What
Yeah.
was it like this Mother's Day for you? This was the first one without her.
Yeah, it was the first one without her, and appreciate you acknowledging the caregiver role. It's one that I tell people all the time is more traumatic uh, than people prepare you for.
Yeah.
There's really not much that can prepare you to be a caregiver. And there were things that I was doing for my mom who suffered from Alzheimer's that she never would have wanted me to do, but it had to be done. And I cared for her in my home with our kids, and my wife and I did that work for many years. And then eventually, as my mom started to progress through the disease, we moved her into an assisted living facility and then ultimately a nursing home. And it was a challenge. And she
Mhm.
passed away a couple months ago. And what gives me comfort, especially with Mother's Day just being a few days ago,
Mm.
was the fact that she's in a better place right now than where she was, especially in her late stages,
Mm.
and that I'm doing what would make her proud. I know that she's looking at the stuff that I'm doing now and is smiling, and that's what gives me the most comfort.
That's interesting. My mother passed 4 years ago, and it's I actually have that same sentiment. And I look at particularly for brothers who are very close to their mothers and having the will to go on when you're trying to be a caregiver, and
Yeah,
she's saying, hey, because she had Alzheimer's, so it's a little different than someone who's mentally there all the time.
yeah,
Were you trying to go in and change her and incontinence supplies? Were you the one actually doing those things before you got someone else?
yes,
So you were
absolutely.
hands on deck. You were
Hands
the
on. That's
all
what
the
I'm saying.
100%.
I mean, my mom would have died had she known that I
Yeah.
was gonna be doing that. But when you're a caregiver and you don't necessarily have the support and resources from a in-home care company or anything like that, you got to
Mhm.
do it yourself. And um, you know, being a caregiver is very humbling some days. I remember there were days where I'd have a great day at work, and
Yeah.
then I would come home, and there would be a mess on the floor in the bathroom,
Yeah.
and I would have to immediately switch modes and clean it up,
Yeah.
and then there would be happy days at home and tough days at work. It would flip. So what I tell folks about the state that we have in Georgia is one where we could be doing so much more to help support caregivers and their loved ones who they're caring for, not just with those who have Alzheimer's, dementia, who are aging or anything like that, but also for those caregivers who are caring for adults with special needs, who are going to be caregivers for decades, right? There's a lot that we can be doing to make that process a lot smoother and a lot better for those caregivers as well. So, look, I think that when we talk about healthcare generally,
Yeah.
people often focus on the person receiving the care. There's a group of people who are helping to care for those folks who are not a part of the healthcare system
Correct.
officially that we
Correct.
need to be focused on as well.
Absolutely correct. And so one of the things that I want to just kind of push back briefly on is you said for you, Medicaid expansion is one of the things that you've talked about. And you just mentioned nursing homes and you were able to put your mother into a nursing home. Is that something that you had to pay for out of pocket or did Medicare and Medicaid cover that for you all?
Yeah. So look, it's one of those things where the state of Georgia literally drives people into bankruptcy before the state of Georgia steps in. So just to briefly tell you what happened with my mom was that my mom was not someone who had a whole bunch of resources. She didn't have a home or anything else. She had a 401k
Yep.
that, and I'm very transparent with folks about it. She had a 401k that had about $60,000 in it when she was
Yeah.
first diagnosed 10 years ago. And then she had Social Security, disability. And the Social Security initially, when she started getting it, was about $1,200 a month.
Yeah.
Because of the $1,200 and because of the 60,000 in
60,000. Yep.
401k, she was disqualified from any kind of support.
Yeah. Yep. Yep.
They treated her the same way as someone who had a pension and a couple 100,000 in a bank account.
Literally. She could have been a millionaire. It's the same thing. Yes.
Same thing, same
Mhm.
treatment. So what I did, I was fortunate. I'm a lawyer. My wife is a nurse practitioner. We both had full-time jobs that paid us well. And so I saved her money over time. And when it came time to move her into an assisted living facility, I actually subsidized her care.
Yeah.
I paid half um, of the assisted living facility costs because I didn't want to deplete her savings. I didn't want to deplete her 401k. So I was actually subsidizing every month, paying half of the care.
Interesting.
Fortunately for me, I could do
Interesting.
that.
Yeah.
Um, Along the way, when she needed the higher level of care, it wasn't until she was broke. She had zero 401k left, and she was just relying on Social Security disability that the state of Georgia said, okay,
You can
she
get
qualified.
Medicaid.
Yeah, she qualified for Medicaid, and we'll take care of it moving forward. And what that brought to my mind was that makes no sense from from a health perspective, but
Yeah.
also from a math and taxpayer perspective.
Sure.
We should be doing what we can in the example of my mom to ensure that people are able to stay home and stay in the level of care where they need to be as long as possible.
Mhm.
Because right now, or at least a few months ago, the state of Georgia was paying tens of thousands, close to six figures every year for her to live in a nursing home when they could have we could have stretched out her resources even more by the state of Georgia helping for her to stay at home as long as she could, for
That's
her
an
to an assisted living facility as long as she could. And it would have cost taxpayers less,
Mhm.
and she would have aged in a place that in a level of care that would have been more in line with where she was. And here's what broke my heart was
Mhm.
we moved her into the nursing home. About a third of the people who were there did not belong there.
What does that
They,
mean?
that they didn't need that level of care. They were relatively independent. They could have probably done well in an assisted living facility, but because they couldn't afford a place to live, the one place where the state of Georgia would cover it was at the nursing home.
Let
And
me go
go
ahead.
ahead.
I'm gonna give you two parts.
Yeah,
One, and this is where this is important, right?
yeah,
That's why I want to say this. So, nursing home, as we know it, is two parts. It's a
yeah.
rehab portion and a long-term care portion.
That's
So,
right.
what you put your mother into was the long-term care portion.
That's right.
One of the things that we struggle with in Georgia, to your point, which is why I was excited to have this, you experienced the nursing home experience that requires people to do what you didn't say it, but I'll say it for you, spend down.
Yeah,
So all the money you have to spend down for
yeah,
Georgia to say, I'm willing to help you. And why that doesn't work for most people, because even once they spent down, nursing homes now still don't have to give you a bed. So
yeah,
now you have nothing to take care of yourself in
yeah,
that situation.
yeah,
Medicaid expansion, as we know it, should help most people. However, here's my caveat and my question to you. Even if we expand Medicaid, right, and we put more nursing homes and in rural areas or more hospitals. I've heard you talk about the need for more hospitals. In my opinion, and maybe you have a different view on it, we don't have these things in place, not because of Medicaid expansion, but because of a certificate of need.
Mhm.
How do we help? Even if we expanded Medicaid to everyone, you have people like myself or people like you who could actually raise the funds and run these programs successfully. How are we going to actually allow people to get helped if we don't have the access to actually open the programs?
The certificate of need is something that I believe needs to be reformed in Georgia, because we need to make sure that we are building the facilities that communities need. And I've seen firsthand how certificate of need is used as a defensive mechanism for hospital systems, but I've also seen how it's used as an offensive mechanism to go after new clinics and new hospitals to try to prevent them from being open, and it's prevented a lot of nursing homes from being built as well.
Right.
So I want to make sure we definitely take a look at certificate of need, that we reform it, like other states have. But here's what I'll tell you is that I also want to make sure we have a lot more options for our seniors, and their caregivers. I want more in-home care options. I want more personal care homes, something that in Georgia is a little bit more exclusive because it's so expensive. But in other states, my grandmother who lived in Florida, my mom's mom, who also had early onset Alzheimer's, when she transitions into her late stages, she was in a personal care home, not because my family had it like that, but because in Florida they have so many personal care homes
Yeah.
that it's actually cheaper to have someone in a personal care home than it is to have them in a nursing home or an assisted living facility. And for
Yeah.
those of you who don't know what personal care homes are, those are homes where you might have 5 or 6 patients, uh, who are staying in those homes. They tend to be homes in neighborhoods and might look like a regular old house,
Yeah.
but they have a few folks in there who are caregivers who specialize in that kind of work. And I want to make sure that we're doing what we can to give seniors as many affordable options as possible. And that's the goal for me. Let's build and give people more options, because with the boomers who are continuing to age, we're going to need as many options and as much support as possible.
Yeah.
And that goes beyond Medicaid expansion. It goes beyond certificate of need. It goes beyond nursing homes. It goes into literally rethinking about how Georgia has its senior care infrastructure and blowing it out, because we're going to have to expand it significantly.
You make a very interesting point there because I look at seniors and I'm also, as of course I'm in hospice, I'm also concerned about people who are being born, the babies, right? And how are we navigating that when you're talking about Medicaid? If we're not going to expand it and people, wanting to go to the hospital and things like that, you spoken a little bit about doulas, right?
Yes.
I saw that. I was very excited because I saw the story about what happened at a hospital there in Stockbridge with those doulas, and I said, wow, if people had access to doulas, this
Yes.
would also help a lot of people. And you spoke about that. What is it that makes you so intrigued by the doula concept? Many people are unwilling to talk about it.
Yeah. Well, look, healthcare is expensive.
Very.
And it's also not as accessible as it once was,
Mhm.
right? Especially if you live in rural Georgia. Going to a hospital, if you're in Southwest Georgia, may require an hour and a half or 2 hour trip. And if you are pregnant and you need to go to the
Right.
hospital, if you live in downtown Atlanta, that's a 5-10 minute trip. If you live somewhere in Southwest Georgia, it may take you an hour and a half, and that may be the difference between life or death for your baby or for you. So what I want to make sure we do is that we have providers who are more flexible, more mobile, more affordable, uh, to ensure that moms across the state are receiving the maternal health care that they need. So I want to make sure that Medicaid and insurance companies are paying for doulas and midwives. They're paying for birthing centers, which is different from hospitals, but provide the same kinds of supports so you can give birth safely, so that people have access to the basic services that they need. So shout out to all the doulas and the midwives out there, because you are a part of an ecosystem that we need to continue to grow if we want to make sure that mothers are able to give birth safely in this state. And look, the fact of the matter is, because of the lack of expansion of Medicaid, because of the closures of rural hospitals, because of the abortion ban, and the fact that there are a lot of OBGYNs who don't want to practice in the state. There are a lot of counties in Georgia that don't have OBGYN services. They don't have labor and delivery services. So we need to be creative and make sure that we're using the tools that we have available to us. And doulas are the perfect example of something, of a profession that's been around for hundreds, thousands of years.
Yeah.
That we should be utilizing more in a state like Georgia.
Are you willing to say that you're going to do the best you can? I like to say it this way: the best you can to let insurance pay for doulas, because right now it's completely out of pocket.
Absolutely.
Okay. We also
doulas, midwives, lactation coaches. There's so many services that Medicaid and private health insurance that they should be paying. And look, with healthcare generally, and you know this very well, Henry, with healthcare generally, if you invest on the front end, it's more cost efficient and cheaper on the back end, right? For me, this is, as a taxpayer, as a business person, I'm trying to make sure that our investment is right. And if I invest in you early, it's much cheaper on the back end, right? If I don't do what I need to do on the front end, it's going to be much more expensive on the back end. So for me, it's the right thing to do medically, but it's also the right thing to do from a taxpayer perspective.
I think one of the things that people overlook with healthcare is how interconnected it is with other things, such as nutrition.
Yes.
And mental health too, right? That's a big part of it. Stress, especially with African American men, the rise in the high blood pressure, right? All of those things play a huge factor. What are you looking at now to kind of bring down the cost of living just as an average person in Georgia?
Yeah. So look, obviously when it comes to healthcare, mental health is a big piece of what we need to do, and what we need to tackle. What I will tell you is, when it comes to the cost of living, we have to make sure that people have access to the basics. And what I mean by that is, we got to lower the cost of housing.
Yeah.
Housing is a big problem in this state because people have found it too expensive to rent or buy homes throughout the state of Georgia. So I want to make sure that we stop private equity funds from buying up single family homes. I want to make sure that we're working with cities and counties to build as many homes, including having an affordable housing trust fund that cities and counties can tap into to help people stay in their homes and to help build new homes for people across the state. I want to make sure that people see a lowering of their utility bills. So I want to hold our utility companies accountable, especially how they treat data centers, to make sure that data centers are paying their fair share. Because right now, data centers are not doing what they need to do by our community, and they're being given tax handouts, billions of dollars that are going to these billionaires instead of going to the pockets of hardworking people across the state. So I want to make sure to redirect that money into people's pockets.
You said,
and the last thing that I'll quickly tell you is jobs. We need good paying jobs. And that goes beyond folks who have graduated from college and have their college degree. I think we need to make sure that we are supporting those who are in skilled trades. It's why I talk about apprenticeship programs and a free technical college system, because I want to make sure that we're supporting those who want to go straight into work from high school.
You make a great point. I'm 38 now, so I was in high school, and at that time in 2000, I graduated 2006, and we had vocational programs. We had where you could have been in HVAC, you could have gone into plumbing, you could have gone into carpentry, all these things that, to your point, give you a job right out of school. And I think what has happened, even with CNA, certified nursing assistants, that program also has gone away. You mentioned something that is very, very dear to my heart, which is affordable housing. And since you brought it up, I normally wouldn't, but since you brought it up, with private equity buying out a lot of main streets in Atlanta or other places, we've lost a significant amount of beds for homeless shelters.
Yeah.
And I'm crying out to somebody, we need those back. As someone who's in hospice, I'm seeing people that we can't even help because they have nowhere to live.
Mm.
Is that something that you've looked at all?
Yes, for sure. And look, um, we need to make sure that we stop private equity funds from buying up these homes. And the way to do that is by increasing accountability and transparency so that those companies can't hide behind LLCs like they've been doing. But we also have to make sure that we increase tenant protections because they're coming to Georgia because they know that they can do whatever they want and the tenants can't do anything. So I want to make sure that we do those two things. But when it comes to homelessness, it's a problem statewide. Even in rural counties, small towns across the state are seeing a record number of homeless folks, and that's because the entire state has gotten unaffordable when it comes to having your own home. So what I want to make sure we do is that we invest in that emergency housing, micro affordable housing, and I'm not talking about necessarily homeless shelters, or I'm not talking about extended stay motels, which take advantage of tenants and is often unsafe. I'm talking about these places where they're almost like apartment complexes where people can go, and when they've hit rock bottom, when they've lost their job, and they're looking to get back on their feet, but they need a safe place for themselves and their families to stay, that they can find it and not have to worry about how much it's going to cost.
To the
We need more
taxpayer,
of that.
though. To the taxpayer, I gotta ask, right?
Yes.
Because people are gonna ask you, how are we gonna afford this?
Look, the way we afford it is by being smart and working with nonprofits and churches and for-profit companies to subsidize a lot of that care. And look, I'll tell you this: it's much more expensive to keep someone in a prison or in jail, which is where a lot of homeless folks go, than it is to have them in one of these places. I forget the statistic, but it's over $10,000 it costs to keep people in jail, and we can avoid that by making sure that we have options for folks to go who are on the streets, and in these places they can get the services that they need to get as far as mental health and connecting them with community resources, and that is a burden off the taxpayer that we won't have to bear because we're being smart. Again, this goes back to being business folks. Invest on the front end. That way it's cheaper on the back end.
I would consider you a serial entrepreneur. Would you agree?
Yeah, I think you're right about that.
Okay. You and your wife have a urgent care, primary care clinic here, correct?
That's right. Northwest Atlanta.
Northwest. Okay. Since doing that, have you seen anything where you're saying, oh, this is something we have to change because now you're impacted on the business side of healthcare and not just as a caregiver?
Yeah. So look, I've seen that as the owner of an urgent care, my wife has found it incredibly important to provide services to those, even if they don't have insurance.
Indigent.
And I have found that we have to hold insurance companies and pharmaceutical companies accountable to doing right by patients. Because oftentimes those companies are playing games, especially the insurance companies are playing games with people's health. They're randomly denying things. They're not paying providers what they should. And because of that, the whole healthcare system has turned into a game of cat and mouse where people are just trying to get their people, meaning providers, clinics, hospitals, insurance companies. Everybody's trying to get their slice of the pie. And the person who's left out without any pie is the patient. So I believe that we need to do a lot more to make the healthcare system more focused on what it should be, which is patient care. And too often, that's not the case. And look, I'm not just going to call out the insurance companies. Everyone in the ecosystem is playing the game that has been laid out. And what I want to try to do as governor is to make sure that we interrupt that game and focus it in on the patients. Because at the end of the day, when a patient is sick and needs that care, it's not a game for them. So we need to make sure that we reform a system that has left a lot of people behind.
You're absolutely right. And for me, when I see that someone has been denied care, Yet on the same time, you told me that they paid you $600 a month for 50 years. I have a problem with that,
Yeah,
right? So I'm with you 100%. But my question would be, though, how?
yeah.
How would you get them to do that? How are you going to get them to do that with the evolution of AI? And now that's going to be your new person that you talk to for
Yeah.
claims, whether they approve or deny. So what are you going to tell them to make them make any changes?
Yeah. So look, a couple of examples on that. One is that I want to work with the insurance commissioner to hold companies accountable when they're playing games, to fine them, to kick them out of Georgia if we need to, but to make sure that the companies that are here are doing right by patients. The other thing that we can do is to regulate the industry to make sure that any patient care decisions are made by human beings who are qualified to make those decisions and not by AI companies.
Mhm.
So there are things that we can do to regulate and hold these companies accountable to ensure that we disrupt a system that has left patients behind. But at the end of the day, we need to make sure we have a governor that understands it's a problem in the first place. And I've seen that problem firsthand.
One of the things I will say that I have my following is mostly seniors or people who actually own healthcare companies. That's what we believe to be about 40% of them.
Mhm.
And one of the things that you've proposed would be Medicare could cover assisted living costs.
Yep.
What does that look like for you? And would you cap it as well? Because that's
Yeah.
the other problem we have with assisted living. Is not that they don't exist. Is how can I put someone in the place at $6,000 a month?
Yeah. So just slight modification. Medicaid would cover the living costs. And what I would want to make sure we do is that Medicaid would cover some of the cost of assisted living, but also potentially cover some of the in-home care that is needed. Because again, a lot of these services are medical services that are needed, and it would be better for those patients to be in that setting versus being in a nursing home. So that makes it a lot more cost effective. There would have to be some kind of cap and regulations attached to it. And I can't really flesh out the program here right now, but what I can tell you is that um, the current program as it stands, where patients essentially have to be in a nursing home in order to get Medicaid, is one that is very costly for taxpayers, and it's not necessarily the best thing for patients in every circumstance. So I want to make sure to give patients as many options as possible, and find ways for the state of Georgia to save some of those dollars to be able to help even more people, right? Because if the state of Georgia right now is helping one patient stay in a nursing home who could probably be at home with loved ones if the state of Georgia supported that patient through $5,000 a month, right? You have freed up an additional $5,000 to help someone else, right? So for me, it's how do we help as many people as possible, and at the same time ensure that patients are getting the type of care that they need. The one size fits all system that we have, where you literally have nursing home Medicaid, is something that I think doesn't work in this environment where the cost of healthcare, the cost of living for our seniors has gone up dramatically.
I could tell you who would be your biggest supporters of that, believe it or not, would be nursing home owners and operators themselves.
Yeah.
Because as we spoke about, the rehab portion pays them about 12 to 15,000 a month, and long-term care is only $4,000 a month. So
Mhm.
if you were looking for help in that area, I could
Yeah.
give you a little hint who might be one.
Yeah. I'm sure they would want to be freed up.
Hey, listen, they can say what they want. I just tell the truth, and that is the
Yeah,
truth.
yeah. But look, it's like I said, when I saw when I walked around to move my mom into the nursing home, I saw a lot of people who didn't belong there,
Mhm.
and who could have probably done well being in home, or being in an assisted living facility. And I think that we need to acknowledge that the current system is not working, especially in Georgia. And that's the main thing, is that I'm not someone to reinvent the wheel. I want to look to see what other states are doing that work well, and see what we can apply here in Georgia to make it our own. It shouldn't be to where I'm looking at what my grandmother and the support that my grandmother got in Florida, or the support that my friend is getting in Virginia, and then looking at Georgia and being like, dang, there's so
Mhm.
much more that we can do for our seniors and our caregivers. In a state that has $15 billion sitting in a surplus, right? That's 15 billion of your tax dollars that are just sitting in a bank account.
Yeah.
We shouldn't live in a state that has the third highest rate of seniors living in poverty. We shouldn't live in a state where 1 million people don't have health insurance, right? That's broken leadership. That's broken government, and I'm running to fix it.
It's interesting because you're hitting every point that every healthcare provider that's out there is looking to hear from someone running for governor. And one of the things, you're absolutely right. A lot of healthcare owners and even seniors are looking for this help. But to your point, a lot of people not being or not needing to be in a nursing home is simply because, one, we do have a certificate of need on home health, so no one can open one. So there's no one to take care of them, and they're forced to go to the rehab portion of the nursing home. And I think for me, I want to humanize this governor position. And I feel like you seem to be one of the people that has lived it from both sides. So I'm actually one of the few people in my group who are going to be excited to actually hear this. Is there one thing that I do have to ask you? That's just one
Yeah,
thing. If you cannot expand Medicaid,
yeah,
if what there's a lot of reasons as it could be more difficult than people think.
right.
If you can't do it, what's plan B?
Yeah. Look, if I can't do it, then plan B is to work with the state legislature to see if there is an opportunity for a public option. If the state of Georgia can help provide people with a more affordable healthcare plan itself,
Mhm.
I would want to explore that. I would also want to explore the option of providing incentives and tax credits for small businesses that provide health insurance for their employees. Because as a small business owner myself, and you know this well, health insurance is
It-
very expensive to provide,
Mhm.
and it would help if the state gave some tax credits or deductions for those small business owners who were helping to provide health insurance and helping us close that gap of uninsured patients. So what I would do is I would lean into the current system that we have and try to find the best options that we could. And again, I'm not one to try to go willy nilly and reinvent the wheel. I want to look at best practices from across the country and make sure that we're doing those best practices in the state of Georgia. Of course, making it our own along the way. But there are certainly models out there where, in the absence of Medicaid expansion, I'd want to lean in so that we would not have over 1 million people without health insurance, and so that we would not have a situation where rural hospitals and clinics continuously close.
As we have $15 billion sitting, one of the problems that I'm seeing more than ever, which is why a lot of people are signing up for hospice, they can no longer afford their medication. It
Yeah.
just is what it is. Do you have any thoughts on how you can help a lot of these people afford the very things that's going to help them stay alive?
Yeah. So a couple thoughts come to mind. One is that again, we have to hold pharmaceutical companies accountable, and to the extent that they are price gouging, we need to sue them. We need to provide relief for Georgians. The other thing that we should do, and I did this as a state senator, I proposed legislation that would allow the state of Georgia to do the same thing that Texas and California have done. Texas is a Republican state. California is a Democratic state,
Yep.
and that's negotiate directly with drug companies in other countries to import drugs, to import prescription drugs at a cheaper price. And I think that as governor, uh, we should be doing. I know what I'm going to do. We should use every tool in our toolbox to lower the cost of prescriptions, and I'm going to make sure we do that. Use every tool that we have to make sure it's a reality.
Jason, last question for you. I know
Yeah,
you're a busy man.
no, it's all
What
good.
does if Georgia doesn't get you, what do
Yeah.
they lose?
Look, I am someone who, and I hope you've seen this over the last 30 minutes. When I speak about the issues, I'm not speaking about it from a polling memo or a policy memo that someone wrote for me because they wanted me to talk about how important it was. I'm speaking about this from life experiences.
Mhm.
And the reason that's powerful is because in a moment like this, where people across this state need real solutions. You want a governor who has lived those challenges. And at the same time as living those challenges, understands what our opportunities are. And that's what I bring to the table. And not only that, I've incorporated this into a vision for the future of this state that ensures that no matter where you live or who you are, that you have the opportunity to thrive, not just survive. And my hope and my prayer is that as people watch this and as they consider voting, and they're thinking about the fact that they're tired of the old politics and a lot of the politicians that got us into these crises in the first place, that they would consider me someone who represents a new generation of leadership, someone who is speaking directly to the issues that people care about, and at the end of the day, has solutions and is building a coalition to bring those solutions forward and make sure that they get implemented across the state.
I appreciate it. Jason Esteves, he came, he broke it down for us. What does Medicaid look like? What does the expansion look like? How we're going to take care of our seniors, everything from healthcare to homelessness. Now you guys get to decide who you guys want to vote for it. Mr. Esteves, Esquire, thank you so much for your time.
Hey, I want to thank you so much for having me. I want to make sure people follow me on social media at Jason Esteves or visit my website where they can find my healthcare plan, jasonesteves.com.
Looking forward to it. Thanks again, Jason.
Appreciate it, brother. Thank you.
All right.